because there's committee meetings, isn't there, already? Personnel and finance? No. Oh, that's the second Wednesday. Huh.
But I just don't know that
I know.
I'll drag people here that day, so I'm trying to
Well, at least it would be 3. If it could still be 3:30, that would be.
We'll be here. We'll be here if you call us.
Yes, we are.
Committee meeting.
It is like, the meeting's on July 3rd, not the 4th, right? Well, I'm here. I showed up. I'm not even on the committee.
Just start. They'll come out.
You want me to go get them?
Well, yeah. Calling the Human Services Committee meeting to order. Is there any courtesy of the floor? Nope. Okay, Tiff, you're up.
There's Mr. Heckman coming in. I'll get those for you.
Thank you.
I would go slow because they're all going to come in, and then you're going to have to repeat everything you were thinking.
I'm sure they don't.
I didn't do it.
They could read the handouts.
I didn't do it.
Hey,
How are you doing?
good.
It's a good thing.
Good.
I think it's good.
Questions from some of the nurses over at Grace. I didn't realize they're not all union.
Are we going to avoid that, or is that an open question?
We hope to avoid it. If not.
So I invited Tiffany here to do a report on some mental health, early intervention, developmental programs, but there was also a press release that I think we want to address. And the other thing I wanted to do is just say that for protocol's sake, I want the presenters to at least speak for 10 minutes or to do what they plan to present, and the members of the committee can ask questions, and then the members of the rest of the council can ask questions after. That's okay. So you got at least 10 minutes, if not more.
We had that forever.
You don't have to talk for 10 minutes.
I will make this brief. So as Lori had stated, there was a press release in the morning call about our changes to the SAP program, which is Student Assistance Program. So I just was asked to come here just to talk about the changes, talk about the reasons why we made the change. And so I'll start with that. Historically, SAP is, the program is designed to be, we're supposed to provide liaisons to the schools. The liaisons are in charge of screening and referring out any kids that are identified as in need of service. Our program is funded, drug and alcohol funds a part of the liaison, and mental health funds the rest. Historically, what we've done and what was put into place is not only did we have liaisons, but we were providing, it was designed to be brief counseling until families could get the children into services. It kind of took on a life of its own, and then when I switched over, I wanted to look at it because we were never referring kids out. We were just continuing to provide the service, and the cost of the service was growing. So at the last contract request, the current provider had requested somewhere in the lines of $800,000 for the program, which we don't have in our budget. We took the 10% cut so many years ago. We've not received extra funding, and we've been just making do with what we have. So we really had to look at the program. We talked to the provider and said, we can't continue at this rate. We're going to be putting out an RFP. So in April, we put out an RFP, and what we did was redesign the program. We took it back to what SAP is designed to be. We wanted to have liaisons available. We wanted to do screenings in the schools and then have them do what it's intended to, which is to refer out. We had, but in doing that, we had to remove the counseling piece. And the main reason for that was we were funding every child for counseling, and their insurance was not being tapped. We are the payer of last resort. We should not have been funding this, and that was confirmed on Monday when I spoke to our rep from the state for OMSAS. She stated that by paying that, we opened the county up to an audit nightmare because we could be potentially required to pay that money back because it's against the regulation. So she applauded us for doing this. She is completely on board with our plan. And when we did the RFP, we had 3 respondents. We interviewed the 2 that actually had SAP background. Everybody was interviewed. They came with their own plan of how they wanted to do it, which were kind of similar in some ways. And then we ended up actually going with the Center for Humanistic Change, who is a prevention provider in drug and alcohol. They do SAP in Lehigh County, so they have this model that we are looking to use is what they're already doing. So they were familiar with it. And we have met with them, and we have a really good plan in place for what we're going to do, and I'll go over all that. And I just wanted to go back and say that in the midst of like trying to switch this, I contacted every county in our region to say, what do you do? Nobody did what we were doing. They were actually kind of blown away by the amount of funding that we were spending on this because there are other means to pay for the services. So what we have proposed and what the center is going to do is they are going to put 3 liaisons into all the districts in Northampton County. The liaisons are going to attend every SAP meeting that's held, which is a change because we were only attending, I believe, 1, maybe 2 a month. They are going to go to every one. They're going to use a standardized tool, which there's a PowerPoint, which the center, I can't take credit for, the center threw this together. A lot of the stats and everything is on the tool itself. It's called BH Works. It's a tool that looks at 14 different domains. So it's going to look at drug and alcohol, suicide risk, mental health. It screens for all that. It's done in 7 to 10 minutes. The child actually does self-reporting, which is in their data they found. They got more truthful responses and were able to identify more people. And then what we'll do with those results is we'll talk to the team, and then we will refer out for services. The reason for the press release was some schools are upset because we are removing the counseling, and what are you going to do and what are they going to do? A few months back before that, Magellan, who's our managed care organization, they put out an RFP saying if you're a school district and you want to put in a school-based outpatient clinic in your school, you apply, and then they got to choose their provider and they put the clinics in. The big thing for the school is do you have a room that they can use? So we had some schools took advantage of that. A lot of schools did not. And so the schools that I think took advantage are kind of not happy with change, but they're okay. They know they have something. The ones who did not, we're doing a lot of work with them to say Magellan has offered you can still apply. You can still have this in your school. So we've been educating them on that because apparently this information was not getting to them. So the providers they've chosen take private insurance. They take medical assistance. Where we might, and what we're working at is kids who obviously do not have insurance. Well, that is what our job is. Our job is to help fund those students. That's the pot of funding that we should have been doing all along, and who we should be focused on. So we are meeting with all the superintendents on Monday. We're having a meeting. The center is going to go over with them what a SAP student should look like through the process, what SAP truly is, because I think that they got away from what SAP is, and so there's a lot of misconception that SAP's going away. Well, SAP isn't going away. It's the counseling piece. We're going to talk a lot about empowering parents. There was a lot in the press about parents won't do this and parents won't do that, and I think that's not giving parents enough credit. And then We added a piece at the county level, which is our CAST coordinator, who typically held the meetings, and for kids who are going into RTFs, they're actually going to be the county liaison for the SAP program, which is something new. We want to have one-stop point of contact. So the SAP team, if there's a concern, if there's anybody saying, hey, there's wait lists or things going on, contact the county. Not only can we troubleshoot that, we can refer them to the right department. The other thing is we look at the child the way we were doing it. We were only focused on the child, but we might find in this screening that the family has a need, or there is a parent with drug addiction. There's other things going on. Well, we have a lot of services that we can offer and supports, but we weren't getting the contact. The county kind of just funded the program. We didn't really have who was in there. So with our new fiscal officer, with myself, we're just looking at, we have to be fiscally responsible with our money. We don't have enough for everything we need to do. And especially that there are a lot of mental health services that can't be funded by any other means. And this is where money was going. So we have the support of the state. We're really want to get ourselves lined up. We don't want to have any fiscal troubles, but we also want to make sure that kids are getting the services they need. And that's where that county liaison piece comes in as well. The center is going to talk a lot. They are in Allentown School District. Obviously, it was their big school district in Lehigh County. They're going to talk and show examples of how it's working, especially they're going to use Allen High School. There are no waiting lists. Kids are getting into treatment. We just want, I think we have to work with them to help alleviate some fear of change. That, the headline was, we left them in the lurch. I think those were was the term. They did not print a lot of what I thought eloquently said. So we really just wanted to get out there and talk to them, give them a chance to ask questions, and also we want to look at what they have in their schools already. There's a lot of duplication of things, and they might have services that can be used. Not every child who's identified needs individual weekly counseling. Could groups be run, intervention groups for those kids who are, maybe they could use some help. Can we do that stuff? But we have to look at what we have and how we can best use it. So Monday, like I said, we'll be meeting with the superintendents. CHC has a plan already in place for the summer that they can go out to each school, get to know them. They've been in our schools doing prevention for drug and alcohol already, so they're familiar with the districts, but they want to go in there and talk to them. They have ideas for stuff that wouldn't cost districts anything, but have been pretty impactful in the schools that they've been working in. So that is our plan. Like I said, this PowerPoint just talks about what SAP is. The map shows the counties that are using this new tool. The tool's actually, the center is getting a grant for the tool, so there's no cost to use it. They're going to get the iPads that go along with it for the first 2 years. After that, it's a very minimal cost. We are going to monitor how many kids are coming in. Our goal is to identify more students. So we're going to monitor who's coming in, see the work. We might have to change. We might have to add another liaison. We might have to switch some things up. But it's really the best use of our funds right now, and that's the reason we had to do it. So I just wanted to come here because it didn't look so positive in the paper, but there is a lot of positives for the change and what's coming.
So the first question I have is, you made the term counseling is going away, but technically it's not. The counseling is not going to be happening in the SAP program. The counseling is going to be shifted to other agencies and other places where it's available. So it's not really going away.
Correct.
It's just not going to be funded by this particular pool of money.
Correct. And like I said, if they jump on Magellan's offer for these school-based outpatient clinics, you're going to have somebody in your school. And on the drug and alcohol side, which is part of the SAP program, they fund the liaison. Students are referred out for an assessment. There's no counseling done in the school. except for Easton, that's a different matter. But for the most part, it's designed, we're just going to be the same now, screen and refer. I know there's concerns about transportation and things like that, but until we get into this and know, we can't plan for all these issues. We have to see, and I think by the school getting on board with the school-based outpatient clinics, I think that's a positive step. And like I said, there wasn't much to it. I think some of them just maybe hadn't gotten the information, but like I said, we're working on that now. Another point to make is we did notify the districts prior to the RFP coming out that change was happening. The current provider knew change was happening in the fall. Some of the districts stated in the paper they weren't aware, so I'm not sure where the breakdown was there. We did not receive any calls from any of the districts until after we let them know, and after the newspaper article. That was the first time we actually heard from them. But we did put it out there to them, so it wasn't a complete shock. We have been talking about revamping SAP for a while, even on the drug and alcohol side before I came over. But now with Tabitha at the fiscal helm, we really jumped on it.
I have two more questions. One is, you said that this organization has some programs already in schools. Do you have a ballpark number of how many schools they're already in? No, Center for Humanistic Change. You said they're already kind of in, foot in the door.
They're in every district doing some sort of program. If you've heard of our HOPE program through drug and alcohol, they do that. They run the mock teen bedrooms that you might have heard ads about. Our prevention program in drug and alcohol is split between Valley Youth House and the center. So they're in all the districts. I can't tell you how much they provide in each, but they are in every district.
And the last question I had for now is the grant that you said that they're getting to pay for the iPads and all the software, hardware, whatever. Is that external to county dollars? So they got a grant from somewhere else to get their equipment?
Correct. It's a program, and I don't know who the exact funder is, but it's outside of this. I think in order to get this program spread wider that they're offering this. And the center actually is already preparing. They have their grant writer attending the trainings on this tool so that she's familiar with it, so that if after the 2 years there is no further grant funding, that she can access her pool of funders to reach out to get a grant to continue it or to expand if we would say, hey, 4 iPads they gave us isn't enough, we need more. They're already thinking down the road, who can we reach out to fund this? They're not automatically just saying, county will be coming back to you, which is great on their end that they're already thinking ahead.
Anybody on the committee that has a question?
It's a question, and actually it's not necessarily about the treatment, it's more about the communication side of it. So there's been a few times that we've sent communications to various entities and haven't not heard back, or entities saying that they haven't received it. Is there a way that if we send it out, we get a receipt from them, and if there's, we send out to 10 school districts and we only get a response back from 3 or 7 of them, can we reach out to the ones we did not hear back from? And the same thing, we had kind of the same issue or complaint regarding, the rehab facilities saying that, they missed the communication. Is there a way to follow up to make sure that,
I can tell you that we're doing that with the meeting on Monday. We have not heard back from every district. And we sent it not only to the superintendents, we sent it to the principals of every building because, unfortunately, it doesn't always trickle.
Sure.
But I believe she was coming, but she's not here. In drug court. Beth was following up with everybody to say, hey, just a reminder that we are having this meeting because we hadn't gotten a huge response yet. But then they might just show up.
Right.
But we've been doing follow-up. In an email, you could do read receipts.
Yeah,
and
I'm
I think
just
we sent letters.
Yeah, just that way, for really any of the communications we do, that really takes the burden off the county that they know that they've received it and they can't use that excuse.
Yeah, and I'm sure they receive a ton of stuff, and I'm sure they didn't even think,
Yeah.
But we just want to be on record that we did notify them.
Yeah, no, I appreciate it. That was it. Thanks.
Anybody else on the committee have a question? Bob, Ron? Kara, go ahead.
I want you to clarify what you said. You said
Mhm.
And that you said that we could be on the hook or open for an audit nightmare if we have to pay the money back. What exactly does that mean, and who's on the hook? You, the county?
We would, yes, we would have to, if it was an audit finding, and knock on wood, it has not in all the years that this has been going on. We ended up paying between ourselves and drug and alcohol $633,908 for the program last year. 96,000 of that is drug and alcohol, the rest is mental health. But if they did do an audit and did a finding on it, we could be required to pay that money back.
And where would that money come from if you had to pay that? That would come from us. That would have-
It would be.
That's what I'm asking. Like, we're on the hook for that then.
Yes.
Potentially. The other question that I'm
Yes.
asking then is, by what mechanism was this money approved for you to spend in the first place to allocate to this program? Not you specifically.
Oh, yeah.
You know, but by what mechanism was this allowed to happen?
I think that our fiscal officer now has really dug into the regulations, is very by the book, has faced an audit to start her career in this division. So she has just really looked into it. I did research. I can't speak for the past fiscal officer or administrators. I can just say the research I've done told me this was not what we have to do, so we changed it.
But is this money not budgeted out every year? And isn't the budget approved by the council?
I would say yes.
So
Don't
is
mean to step on the.
I'm just asking these questions because I think
Yes.
that this is, that
They,
if we
they
want
never
to
should have done it,
understand-
they never should have done it in the first place.
But to understand the fiscal responsibility and in the future, so that this council and future councils do not make this mistake again, we have to understand the mechanism by which this was granted. And allowed to happen.
Absolutely. So it's the concept of the county being the payer of last resort. So mom and dad don't have private health insurance. You're not, maybe not eligible for, is Magellan Medicaid? Magellan is Medicaid. You're not eligible. You fall in those cracks. Then the county picks it up,
Okay.
pays for those services. We were providing those services as payer of the first instance, and we should not have been doing that.
So should that have been submitted to Magellan or to Medicare or Medicaid?
No.
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 And Sue tells me that the county would not be responsible from the general fund. Something worse would happen. The next year's allocation for mental health would be cut by the
Okay.
by the amount of money owed.
So how do the students in schools access or tap into their insurance? Is that only outside the schools that they're able to do that?
It is outside the
Okay.
schools. It
Unless they
depends on
have-
if the provider has a license. The current provider was not licensed to practice in the school with counseling. You have to have a license that, in
Yeah.
your license, you can do it in
In the
school
school.
because we have a drug and alcohol provider who does that.
Because you mentioned something about Magellan offering outpatient services in the school.
They did a program to create these school-based outpatient clinics. So by putting a clinic in your school through Magellan, the providers are credentialed, they have all the licensing requirements needed, and they can fund.
They can bill insurance.
Magellan, they can bill private, and a lot of them take private insurance because they're bigger organizations within the community. It's not just one provider either.
Okay.
So that option is there.
Can I jump in here and ask a question? And you may not know the answer. Center for Humanistic Change may have a better lens on this. But so the liaison does the screening and determines a child needs a service. Who then becomes the case manager to follow that through, to determine how they have insurance, where they need to go? Like, who then handles that child and makes sure that everything falls into place?
So the liaison is a part of that role, but every SAP team should have a case manager, which usually ends up being a teacher. So that's one thing we're going over with them, is what a true SAP team should look like, making sure they have all their pieces in a row. But they're going to assist with that. If there is someone who doesn't have insurance at all and needs help applying, that's where we want them to refer to the county, to our division, so that we can assist them. They can do the basics, but we want to be able to help. That's what our role is, to be case managers, to do social work. And we really want to get back into being involved in that process.
So the caseworker is going to be like Mrs. Smith who teaches third grade, like that's the teacher?
As far as like guidance to them, they're all trained. They have to go through specific training to be on a SAP team. They have basic information available. When it gets complex or there's complex needs, that's when, like, the liaison is also there to help. The liaison's going to know who has openings, things like that. But that's when that CAS worker from our county is going to also be able to jump in and say, let us help you. We're going to troubleshoot the more complex issues, which is what we should be doing.
This does sound complex.
It really isn't when you see it, and we're actually going to have a PowerPoint to show them.
You're gonna like show the team structure?
Yes, and show a child going through the process, because.
That's helpful.
Yes, because
Nice.
it's a lot to wrap. If you haven't been through a SAP process, personally, it is a lot to.
It just seems to me that it would be overwhelming for the teachers who have to identify these students and then have to be case managers on top of the load of schoolwork that they already have that they're, accomplishing daily.
And that's why we're doing the screening. We had talked about, should we have it for the schools to do, or the guidance counselor? We have to remember, there's still guidance counselors in the school too, and they get involved as well. But we didn't want to do the screening also. We're trying to baby step into this, and our liaisons are very confident once they're trained, they can do a screening, and know where to go and where to send people.
So it's not that teachers are screening anybody. It's that they're identifying who might have a need, sending them, and then maybe.
I can understand why.
They get a
SAP was
referral
going
as a
away.
SAP team. That team, once they have a referral, they meet as a team. Our SAP liaison's going to sit in on all those meetings. And then the liaison will do the screening for anybody identified and then help on the refer out.
So perhaps we should
Thank
have
you.
them back in at some point to talk, after they do their transition, how it's going, and we can invite them here to talk a little bit more about what they're doing. I think Mr. Heckman had a question, and Mrs. Ferraro had a question or comment also.
Thank you. And correct me if I can help. This sort of almost, in some ways, the dollar thing we're talking about relates a bit maybe even to in the past with Graysdale. I remember years ago we weren't doing everything we could to capture money. We were footing the bill for things that we could have billed or gone to private insurance for. And that's one reason why we brought in a consultant that was then kicked out. But we brought in a consultant who, that's going back some years, but a consultant who said, hey, you guys should be checking off this, and this. Now, we were trying to be nice people. And we said, well, these people, they're family, they're all poor, everybody's poor. So we're not going to bother, we don't want to do it. For whatever reason, we didn't. I'm guessing in some of these cases, as far as the dollars go, it was a situation where well-meaning people in the division, just like in maybe some other divisions, said, you know what, we want to help. Somebody asked us for help, we're going to help. And if the regs are a little complicated, case managers are altruistic people, usually, at heart. And sometimes, if the administrator of that division agrees, the fiscal person always worked under the direction of the administrator of that division. And sometimes the fiscal people knew who wrote their evaluations, and not that they did anything wrong, but they'd say, well, you're not breaking the law. I mean, they may not say, you know what, we could be on the hook for this, because they're not legal experts either, and the state doesn't make it easy. So I'm guessing if, in fact, an audit happened, I mean, there'd be a lot of other counties that would be affected. Just us?
No, just us.
Well, I can't speak for, as of right now,
Yeah.
the counties I've talked to, I'm in the Northeast
Yeah.
region, so I've talked to, no one provides the counseling. And actually, it came up as a question, somebody said, well, how was Northampton doing this?
Wow.
I wish they had
So,
exhibited.
yeah. So, I mean, we could always negotiate. If you go to court, we could always argue, throw
Yeah, I think
ourselves on the
that it
court's
was-
mercy.
It was
Maybe
designed
get a
with a
cheaper
good
rate.
purpose, and
Yeah.
it was designed with the best intention. We wanted to, there must have been a gap, and we wanted to
Yeah,
fill the
yeah.
gap. However, we
And I know
can't
that
fill the
happened a
gap.
lot with drug and alcohol, too, because they hardly got any money over the years. They still don't. So oftentimes we would just go above and beyond. I mean, usually there isn't a penalty other than the county's spending money, but now somehow we ran afoul of of a regulation. But as far as the SAP person goes, controlling things, if I'm correct, and once again, correct me if I'm wrong, this is the second part. When it comes to county services, no one but the county or a judge directs what we do or what we don't do. In other words, they can have a person at school identify and they can work with an organization, but before county dollars plug in or we get involved and operate it, it's going to be a county case manager. So the concern of would a teacher somewhere be controlling what happens or doesn't happen with our services, that shouldn't happen.
No, the liaisons are really our representative in the school to control what happens, and knowing what we know and changing this plan, we're going to have tighter control.
Yeah, they would come to you then, the liaison, and ultimately you or the case manager would make the decision. Correct?
We're going to, yeah, they know what their role is and what they can do, and anything outside of that, they know they have to come to us. I think it just kind of went one way, and we've just had to bring it back, unfortunately.
So up to now, the liaison, it had gotten to a point where the liaison could actually make the decision and we'd follow through?
We really didn't have much control, like, on how they were doing it, because it was a very
okay. No,
system that
every contract generally has a point person, and I guess that's what I'm getting at. Every contract in human service, there's somebody, when you get those forms and you read it, it says point person or contact person, and it has to be a county person. I was just surprised that somebody outside of the county would have control of that.
Well, and they were operating within.
And I'm glad you fixed it. I'm not going after you. I'm just trying to learn.
See anything different with what they did, but. Like I said, we have a new fiscal sheriff in town, and she's not letting anything
Good.
Not having that.
slide by, and she's all about the taxpayer dollar. So.
Well, thank you. I just didn't understand how that happened. Yikes. Okay, thanks. That's it.
I have a quick, explain liaison again. Is that the teacher?
No, the liaison is someone contracted from us. They work for the Center for Humanistic Change, and that's their role is just to basically be technical assistants to the SAP teams. So they go in there, they're part of their SAP team, but their main role is what do you need help with, what's not working.
Right, okay, I should know that.
And now we're changing it that they're going to add the layer of, on top of that, they're going to screen the kids for the teams as they're referred, and then they'll help, and then they link with us.
I retired 18 years ago, and SAP was a huge part of our school, and the teachers and the SAP team were extremely dedicated, and that's when I read that, SAP is going.
And it's
and
not
so
going.
I'm so happy to hear, and I
appreciate
your presentation.
Thank you. SAP is there. It's just changing a little bit.
Yeah, we did so much with humanistic change, too.
The CAS coordinators, I'm sorry, but the CAS coordinators, going to Ms. Ferrara's point, they ultimately, any of these referrals that you were saying before, they end up with the CAS coordinator gets involved because children and youth might be involved, or
they can come to the CAS coordinator is going to be just kind of like they can do anything. So if a kid is basically referred, identified, and goes to the outpatient clinic there, and they don't need us and they're good, that's fine. But if there's some kind of something's going on with their insurance or they have no insurance, what do we do? The CAS coordinator is going to be available for that SAP liaison. Here's your point of contact into the county, rather than do I call mental health? Do I call children? Who should I call? You have this
so they may or may not get yanked in.
They may not get, and we're hoping that they're not needed on, because that is more than I think they can handle. But we wanted to give we always hear, I don't know how to get services as much as we market. And so this is one point of contact. This person knows what's available in the county and can say, here we go. One other quick point.
Sorry, Mrs. Ferrara, I didn't want to say.
No,
it's been a few years for me, too.
I know. But I just know how big it was.
Yeah, it's always best.
So it's not going away, but really,
kids and discipline kids.
so it's, the bottom line is, the contracted agency who was doing all the counseling in the school is not going to be doing all the counseling in the school. Counseling is going to be disseminated to other agencies and possibly taking advantage of this Magellan offering to have clinics in schools.
Correct.
Et cetera, et cetera, et cetera.
Two other points to make. One, the center also is going to see what the needs are in the schools because they're going to be at every team meeting. That will open up to say, hey, there's all these programs out here that we have curriculum on that could be implemented in your school. You might want to look at doing this. A lot of schools don't know what the center or Valley Youth House can provide. So by doing this way, they're going to also show them how it can go through a continuum and say, yes, we're treating this person, but on a whole for your district, this might be beneficial to you, and here's a program. Is it something you're interested in? And then we were talking about the saving of money because that came up a lot. With the money that we are not putting there, because they can fund their stuff through other means, we're using it to expand our housing programs in mental health, our employment programs in mental health. The need in mental health is far exceeding the allocation that has not grown, even with the inclusion of forensic money. So all that money is it's not leaving mental health. That was another, I know the mental health folks get concerned when we change something.
Right.
It's staying within mental health. It's just going to fund the programs that there is no funding for. Room and board for some of our housing programs is strictly on the county to fund. So those are different programs that we're going to be benefiting from us getting this fiscally in line.
Is there anything else that you wanted to report? Because you have a lot going on. I went to the meeting the other day, and everybody's working hard, but is there, do you want
We're
to?
just working hard, getting ready for next fiscal year. That's a lot of rollover in DP of plans, 1,000 plans that they have to review and do. Early intervention, the numbers just keep growing. We are anxiously trying to fill our 2 open positions that will hopefully happen soon. And mental health, we're just continuing to work on the forensic programs in addition to everything else. We have the grayscale program going. We have our boundary spanner program. We just selected Haven House as the provider. That should be up and running soon. And our LTSR, which is our long-term structured residence, is still going. But opening a new facility is a lot of work and red tape, and we're working through that, but it's still going. So we have a lot going on right now, and I just want to give credit to Tabitha because Tabitha has really, and her team, they've sat down and they have really cleaned things up, and everything can be accounted for, and that's really what we needed.
I want to come back in the fall and talk about the forensic program? Because
Sure, I'd
because
love
when did
to.
we actually get those dollars? It was like late last year, early this year?
Yeah, we got them in October, I believe, and we are going to get the funds annually, which is nice. We've had to change some things. They let us revise the budget. We haven't had to go ask for more money yet. We don't know how that works, if there would be an opportunity for more if we need it. So I can gladly come back and give you an update because most of our programs are up and running except for the LTSR is hopefully will be up and running next year, but that's just a work in progress. So I'd be glad to come back.
Thanks. Yes, sir.
How do we stand on acute mental health beds in the community right now?
We could use more.
I mean, I guess a rough estimate. How many do we have? Hospitals or?
That I don't have those numbers offhand, but I know we do not have enough.
I'd just be curious if you
We're doing
get
a
'em.
lot of work. We just started working with the hospitals, doing some complex case, making sure that we're not just always referring to a certain level of care, and because our use of those beds has been on the rise. So we just had meetings with Lehigh Valley and St. Luke's. We're doing complex case to see, are there other services out there that we should be using, and not the go-to isn't just put them in the EAC, put them here, put them there. We want to make sure we're putting them in the appropriate service that they need and having those beds available for those that need it. But there's never enough beds.
Well, right now, but I was curious because as we drove to get rid of inpatient mental health services, period, and you read the paper about the Allentown State Hospital and getting rid of that, and the drive to put everybody into the streets because we have drugs now that'll treat people. There's still always has been and always will be. It seems like the number of beds have gone down as the need for intensive, at the very least short-term acute care inpatient has gone up. And I know the hospitals over the years have depleted their beds because you don't make a lot of money on the mental health beds. I mean, it's just economics. And as an Easton executive told me decades ago, we make more money in a heart unit than we do in a mental health unit.
Absolutely.
So I guess I would just be interested to know where we stand as far as the community, the hospitals, and how many beds they make available. Or do they have a floating number where they say, contact us and we'll let you know if we have a bed or not?
Yeah, I believe, we have a certain number of beds in certain programs that, that are designed for different counties. About the hospitals, I'm not too sure on that. I can get that information.
I guess I'm wondering if somebody has a mental health crisis and let's say they need 72 hours, where do they go?
I think that the problem we see more of is they're in the hospital and now they have to come out of the hospital and we don't have step down available because they're full. So we're working hard on what programs we can put into place to have more step downs, move people through the system more. I think sometimes they get stuck because there's not that next level that they need. And that's where this money is going to go towards helping, because we need to expand the programs we have so we can provide more service.
Thanks.
Okay. Thanks. Director of Human Services report.
Hello, everybody. I have reports on a few different topics. We had our suicide prevention task force, our larger sort of initial meeting last week at the Human Services building. I think I've told you that the smaller group of us, about 15 of us, have been meeting since July. So this is where we strategically found some additional folks from the community across different sectors to come to the table for a 2-hour presentation / meeting last week. Jen and Dawn were both there as well, so they are participating, which is phenomenal. We, as a committee, ultimately decided to have 4 subcommittees. Those include school, community, healthcare, and aftercare. So the goal was that by the end of last week's meeting on Wednesday, that the 40 folks who ended up coming to that meeting, which we were thrilled with, that they all signed up for a subcommittee. A bunch of people signed up for more than one. I think all but about 3 people who attended the meeting have already signed up for a subcommittee. And so now we are continuing to expand even further and add additional members strategically to each subcommittee every month. So folks are still welcome to participate when they would like. And we'll start to hopefully be able to explore some grant funding opportunities to do some things on a larger scale. But in the meantime, we'll go old school and grassroots and do what we can with limited resources. I wanted to update you on a few things about the aging division. We have one of our supervisors for the Ombudsman and Caregiver Program is retiring next week. She had planned to retire at the end of the year, but decided it was time now. And I think she had 3 months of vacation for the year anyway, so it was just, kind of why not? Life is short. So we're happy for her on that. But interestingly, she's the last supervisor that had been there under Mr. Mailer. So every supervisor, deputy, and administrator are new within the last year and a half. You all know that protective services was the huge focus in that division and pretty, seemingly disastrous. There was no one at risk, but it was certainly a needing to be cleaned up. We are expecting the state come back. The state is supposed to come back at the end of this month. It was originally scheduled for May, but they were running behind across the state. So they will be back in June, and we will hopefully have more good news in July. So cross your fingers for us. But now that we really have that in a better position, and I don't know if anybody, I think we talked about the Auditor General's report last time, and maybe I mentioned that the state is now auditing, if you will, protective services in real time. So in theory, if we are having ongoing problems, we should know about them immediately, which is certainly much better for us and for our county residents. So we can fix things as they come up immediately instead of finding out, well, you've been doing this wrong for the last year. So that will be the end of this month. But now that is settling down, Lori Greco is able to really take a deeper dive into the other programs as well in the aging division, and is finding a lot of problems in those divisions as well. So that's a long haul. None of these are safety issues, thankfully, but they've not been able to meet requirements in terms of paperwork and serving as many folks as we would like to serve, even though again, there's not safety issues. So that is going to take us quite some time. We've got a good handle now on one or two of the other programs within aging. We have one more to go. The Ombudsman Program, I think I may have mentioned in the past, we are going to be contracting out. There is this crazy rule within aging that protective services and ombudsman have to be, like, if we could be in separate buildings, they would really love that. And there really was an issue about even being on the same, like in the same area on the third floor. So it is a difficult program to manage because it's primarily volunteers and one staff person. And that's the supervisor who is retiring, so it's good timing for us. We are contracting with someone from the middle of the state who has a lot of expertise in the Ombudsman Program. So she is going to help right the ship until we can get that contract with North Penn, which will then allow us to have more ability to focus on protective services even further. The reason we didn't know about some of the ombudsman problems is because of this separation of PS and ombudsman, Lori Greco was not even allowed to access anything in the system regarding the Ombudsman Program. So she had no way of even going into the system to find out how things were going, and was at the mercy of the state to let us know when they were having problems. So she has now developed a relationship with someone at the state level who is she's communicating with on a weekly basis in order to rectify as best as we can until we have a contract in place. So the issues, we also have issues in our options program. I can't speak to that very well. It is essentially providing in-home services for residents to be able to be maintained in their home instead of having to go into assisted living or a nursing home. Part of that is simply caseload size. Those folks at the moment have caseloads of about 160 cases per person. It's not like children and youth, but the average caseload size should be 60 to 80. So no safety issues, but we could be doing more if we had a better handle on it. So because we contracted the Ombudsman Program out, we took that caseworker position, dumped it into options, digging around for some other FTEs we still have on the books that are vacant to add additional staff there as well. So it's going to take us a little while to dig out of as well. But that is the next one that the state is looking at. I understand that Lehigh County was able to be a pilot test site for the options program. I wish we could have been. It would have exempted us from this year's audit, and we would not have been actually cited for anything being a volunteer, but we didn't have that opportunity. And I think Lehigh barely scraped into the yellow. They're using that red, yellow, green. So we are working on that as quickly and diligently as possible, but it's going to take us some time. So this was just an interesting fact. Let me see. I came across a McKnight's Senior Living article, and the 60-plus population is going to outnumber the rest of the population in 18 states next year. Hang on. The 60-plus population will outnumber the population under 20 in 18 states next year, and PA is one of them. So
In 20 what?
I'm sorry?
Next year.
In 2020.
Yes, correct. So somebody in the aging community taught me about the silver tsunami. So I did not make that up, but we know that referrals into our aging division are increasing. Sorry, Mr. Heckman.
I call it the grain storm.
That too.
They're coming
Or you talk to your hairdresser.
That's right.
That's correct. So we only anticipate services to our seniors continuing to increase significantly. So we'll see what that brings to our aging division over time. Something that I will let Laurie talk more about, because I think she'll be next on the list, depending when we have our next meeting. The senior center, so AAA, but the senior centers applied for and got a grant. I think we were here quite a while ago because you all said let's just make the motion and have a resolution ready to go. So, frankly, much to our great surprise, they got the grant. So it is, I don't even know what all it's for, but the one big thing is this co-pilot program, which will automate everything at one senior center where they're going to pilot it and give them all kinds of data for you, Ms. Fargo-Hefner. So we're really excited about that. That was, I think, about $150,000. So, in fact, I think if there's not a agenda item tonight, it will be in terms of changing the fiscal year on the resolution for that grant. So that's it for aging. Health choices. I didn't know if I announced the new administrator last month, but Christy Bernard is our new health choices administrator. I did steal her from children and youth, so Mr. Dolan is perpetually mad at me. I really tried not to steal her. I actually tried to talk her out of it, but no luck. And she's fantastic. So my deputy, Robin Barbosa, has been training her for the last few weeks, and they're just across the hall from each other. So she'll be flying on her own soon, but Robin and I will be there for her assistance. And the state did just grant us, through Health Choices, one of our reinvestment plans. We had a 5-year housing plan that was set to expire, I think, June 30th. And we just heard early this week that the state gave us permission to extend that, which is fantastic. It's a 20-unit, we have 20 apartment units, and the idea was for folks to reside in one of the units until they received a Section 8 voucher. 5 years later, there's still no Section 8 vouchers, so there was still no place for these folks to go. So had we not gotten that extension come June 30th, July 1st, we would have had a big problem on our hands. So that was a big relief. Children and youth is really the next, kind of the rest of the bulk of it. It is Child Welfare Month, so Mr. McClure was at Children and Youth on Tuesday and issued a proclamation to them. They've been having sort of small retention events every day this week. Did you hit up the food truck?
I didn't.
Missed the food truck. They didn't give you a taco.
What?
Should have given you a taco. So the food trucks were there on Tuesday.
No taco for you.
They're so good, too. And part of why they're doing something every day this week in the month of June is the federal folks were finishing their audit with us. In fact, I think they were finishing today, and the exit interview is tomorrow. So so we'll see. That should go okay. I got an email from Mr. Dolan on my way here that they keep a running total of referrals into children and youth on a monthly basis, and through May of 2018, we're already at 350 more calls than we were at the same time last year. So it just
Say that number again, please.
350 more through the end of May than through May of 2018. So those numbers have only continued to go up with no additional funding. So that's obviously a problem for us. I just wanted to pass this out. I came across this. It is America's Opioid Crisis, the Unseen Impact on Pennsylvania Children. And I know this is I feel like a regular topic every month about the opioid crisis, and certainly it has had an unbelievably negative impact on child welfare. So This was just and I won't read it. Y'all can read it. It was just sort of an interesting stat sheet to really get a visual of how it has impacted. And on a similar note then, the annual Child Protective Services report came out. It's very lengthy. I read the entire report, but I wanted to highlight just a couple of things for council, just to give you a picture. Now, this is statewide, not just Northampton County. But in the state last year, so this is for 2018, they had 46,617 total reports. Now, this is just Child Protective Services, so this isn't general protective services. This is specific to child abuse, not neglect, or other sort of more general concerns. And the bulk of those were by mandated reporters as opposed to permissive reporters. And of the mandated reporters, the overwhelming majority were by school employees who were not previously mandated reporters. So that's in large part is what accounts for the increase in referrals that we get. And all of us who work with youth in some capacity, we all need our clearances. So I just found it to be interesting that there were over 825,000 child line clearances processed last year in the state of Pennsylvania. So when they get it to us within a day nowadays, that's actually pretty good. Of those 825,000+, 2,300 were identified as perpetrators of or alleged perpetrators of child abuse.
Really?
What?
Of the
2,300.
Of the
Yes.
825,000, 2,300 were
Correct.
known perpetrators.
Correct.
Snuck through the cracks.
What did
Oh, snuck through the cracks. But how?
I don't even understand how that's possible, because you have to voluntarily fill out that form, and you know if you are a perpetrator.
you would think,
Wow.
Ms. Zirinsky. Now, maybe the alleged
Well, there's three
perpetrators
forms.
don't know, but
There's three forms yet. There's three things
well,
you have to go
Childline,
through.
FBI, and PAA state clearances, but this is specific just to Childline.
So 2,300 people voluntarily outed themselves.
I can't answer that, boy. We can imply. We can
I mean,
suppose.
it could not be a major reason. You might think to yourself, I could do this, but between the three you have to get through.
But you'd be in
Somebody's
denial.
gonna, well, I mean, they're really strict when it comes to the child situation. I mean, it may be anything that's holding you up.
So this is, it's not just sexual, it's not just pedophiles, it's
No,
any
it's
kind of
not.
child abuse, yeah,
Right.
but it's still something that's indicated, founded, not just,
Well, you said.
Child
it was
safety.
Well, it is-
Indicated.
It's founded.
what's that?
It's a founded
Right, so,
file.
or it is also includes folks who are still undergoing allegations. So I don't have the number of, it doesn't break it down between, no, it does. Of that, 2,000 were substantiated perpetrators, 222 were alleged perpetrators, and 53 were alleged perpetrators where the outcome was pending criminal or juvenile court.
Do we have that? Can you just send that and we can have that copy? Linda can get
Yeah.
it to us?
Yep, I think I got it somewhere that it's public information, so I will, as long as it is, I'll send it to you. The only other thing related to that report that I wanted to mention is there's information on the hearings and appeals. So when we at the county substantiate an abuse allegation, a family or the perpetrator has the ability to file an appeal, and they go to Reading for their Bureau of Hearings and Appeals board. Our court has been very good about working with us thus far, at least in the last year and a half, about when we are going to be substantiating an abuse allegation. If we have the right kind of information, our court will now make it a founded report right then and there. And once it's founded in court, the parents or the perpetrators do not get to appeal that decision. The reason that's so important is because if it's our finding and not by a court, the family gets to appeal that. And for example, in 2018 in Pennsylvania, there were 1,900 total appeals. Hang on, I have this written down wrong. Of 2,000, almost just shy of 2,000 appeals, only 982 were upheld. So many of ours get overturned because either it's been too long, the child no longer is willing to testify, there's a whole host of reasons. So, thank you. I'm good, thank you. So if we can have them founded within our court system here, there is no appeal.
Done deal.
Yep. So that was just, the hearing and appeals is a huge issue in children and youth that we've been working on. So our court's cooperation has been very helpful, which leads me to the next point. Children and Youth and Northampton County Court of Common Pleas were selected for this year's SWAN, Statewide Adoption and Permanency Network, their collaboration award. So they are receiving that at the end of this month up at Kalahari. And in addition to, just the honor and procedure that comes with that, we were able to send our adoption supervisor to the conference free of charge, which is good because the way we're watching our budget, she would otherwise not have been able to go. So that was exciting. And then lastly, for children and youth, Mr. Hackman had asked last month, I will pass these out for, we were talking about, I think, was Mr. Dolan here last month? Was that last month? Okay, thank you. He was talking about the cost per day for kids in foster care. And Mr. Hackman had asked for that data going back to 2014. So it's broken down. It's broken down by months, month and year, and it has. You'll see. It does very much a bell-shaped curve, but it has the number printed in at the top of each section. So it's the month and the year, every month for 2014, every month for 2015. And the total number of kids in care at the top. So I wanted to just share that since Mr. Heckman had asked for it. You're welcome.
Just very quickly before you take on Graysdale, we have to begin to talk about the future of human services funding. We have an excellent relationship with all of the Commonwealth administrative departments that oversee our divisions. They are very fair to us. We're very fortunate to have the good working relationship with them that we have. The legislature, on the other hand, is not keeping up with the mandates that the legislature imposes and is duty-bound to fund. And right now, we're on the border of having to deal with unfunded mandates, which means that there will come a time, and this has occurred in the past episodically, but there will come a time when we will have to decide how much county money are we going to put into human services. And by county money, I mean general fund money that is raised through the real estate property tax. And the reason that is an issue is we don't have an income tax. We don't have a gas tax. We have a real estate property tax. And the property tax was once the most progressive tax that could be instituted. It's not anymore. Now the real estate tax is whether your school taxes and your municipal and our taxes goes up could determine whether you stay in your house in Northampton Borough, for example, or not. So what will that be? What will that look like? We have to start thinking about what's our commitment going to be. What will the hard decisions be that we make? Because it will be hard. There will be services that go unmet, or you're talking at least a mill so just so not to panic anyone. In the short term, we are fine. In the short term, we are fine. But it's our obligation to also look over the mid to longer term and decide as a county going forward what our sort of general philosophy is going to be about this. And my philosophy is Harrisburg has to pay for their mandates.
May I add something, Mr. Executive? Because you brought up, I think it would be helpful, too, for councils, especially those of us that are newer. As you said, over the years, there are certain areas, for example, children and youth, where there's a match. Like mental health doesn't have a match. They didn't, but maybe, I don't think they do it yet. It's 100% state gives you money, but that's whatever they give you, that's it.
Right.
Whereas to pull down, let's say, children and youth money, you had to put like 10% of county. But throughout the years, at times, as the executive said, that with doing that, because we have to give that, people said, well, don't give all of that match, and be like, okay, so we're going to give up $9 for one, and as far as getting rid of services. But once we do that, there's still going to be need, as he's pointing out, over and above that, and we've tried to get the message to the state. We do the needs-based budget. They usually subtract 10 to 15% and send it back to you. And I agree, and my concern isn't just the state. And I'll say it because now I'm sitting here again, and it hasn't been a director. We at times on council, plural, over the years, have played politics with overmatch. I can remember council people saying, why are you spending X amount over what you must spend in that program? But then the pushback is going to be, we can spend as much as you want, but there will be these things that won't happen. And I think we just have to all be, regardless of where we come from, conscious of that. As the executive pointed out, it's going to get tougher as we go forward. And the term match and overmatch, I remember there was a time people said, we don't want any overmatch. Well, overmatch is exactly what he's talking about. If the state doesn't supply the money and we only give the minimum, and the services will either go unmet or we'll have to give what has been referred to as overmatch. But it's essentially money, just like we give to the prison, just like we give to the courts. Our choice isn't going to be, well, somebody's doing some evil thing. No, it's, do you want to spend money, and it's going to have to come from the county to do these services. And I agree with the executive. The Harrisburg has been behind on this for decades. And these guys in the state legislature and the state senate passed bill after bill after bill. Other council members have brought this up. And they get a great applause. They go to places, people are cheering them, but they don't come up with a funding stream, and you get stuck with it.
Well, and sometimes you're a victim of your success, and Sue's
absolutely
part of her report sparked this need in me to stand up and start talking with you about this. You know, she talked about how we are doing better with the appeals by going to our court. Well, that results in, thank God, more placements. But someone has to pay for that.
Right.
And the state's not paying more. We get what we get, and once it's gone, it's gone.
I just wanted to emphasize, you're making an excellent point, and it's a point that's been lost on councils sometimes. And I think it would be good for councils to understand now that we can no longer, it's going to be one or the other.
Well, in the past, for example, no, I don't want to make a partisan point, but when administrations changed, you could maybe count on more money from one than you received from the past one. I don't think you can count on that anymore. I think the legislature is sort of, in its own mind, hit a cap. And they're slowly increasing it, and only slowly when they do. And I don't think it's ever going to keep up with their mandates. I think those days are over.
Sorry.
And why is that?
Well, can I just...
They don't want to raise income
No,
taxes.
it is. Why is that? Why?
Because they would have to raise income taxes.
Oh, and they want to get rid of taxes.
They don't want to raise taxes.
No taxes.
They pass feel-good
So then they would pass it on to
legislation
us so
and
that
then,
we raise taxes.
Leave it
Is
to
that it?
us to pay for it.
Because somehow you have to generate the revenue.
There are mandates that we have to fulfill, and those mandates will be fulfilled. But
By county.
with the money that we get from the state. And then the question that we're starting to debate is what will be our, because that's what we got into with Graysdale. Graysdale was $4 million, $5 million, $6 million a year. You could potentially see something like that with human services very easily. It's something we have to start thinking about.
Yeah, we definitely.
Thank you.
Yep, thank you.
So,
That's all
in the
that
interest
I
of
have.
time, because I have 20 minutes, but I really only have 15, I'd like to get to Graysdale.
Fine with me.
You're done.
So I would say if anybody has any questions to direct them to. I had one little question, which I'm happy to ask you after the meeting because it's not important. It's not, the creek isn't going to rise or sink because of it.
evening.
Good evening. It's like church, you know?
Go ahead, Jen. You
Right.
don't wait for this because we're.
Well, just a brief overview, if you want to take a look at it. There are some points I want to make from it, but you can see average daily census is down a bit. We are working at that diligently. Mike in the admissions office and Kay, our new clinical liaison, they have a plan, and we're beginning to get out there, go to the hospitals more, and really inundate to get the census up to where it needs to be. So if you look at the first page, if you have any questions.
I guess, do you have a reason for the being low?
5 months of negative press.
It doesn't hurt, yeah. But
That- And then, it's summer. It's nice out, less sickness. People aren't going in.
oh, I was going to say, oh. The monthly average cost per resident went down too. Why is that? Just because less illness?
Well, less residents.
But it's the cost per, so it should be this, you should be spending the same amount of money on each person regardless, or
Well,
is
if
that
you-
seasonal?
If you have a lower census, you're going to have lower expenditures out.
Less overtime, less.
Oh, less overtime, okay.
Yep.
Oh, okay, I get it. Okay.
And then the second page goes in over nursing agency costs, which we are still working on.
Oh,
We've been hiring very quickly, much to the chagrin of human resources. We're getting them in at a 2-week basis to get them in and get all their testing. But we're making headway. You can see the staffing numbers. The call-offs have decreased, which was nice to see. We were at 498 for April on the second page.
Although
So-
the MFLA, or the FMLA and the IFMLA went up since last.
Yes.
But is that due to the nice days too? Just the 4 this week that we had? Everybody called off?
You can see the wounds on the third page are down. Reportable infections, down. Falls are up for April. We are again working on that with the Falls Committee, looking at different avenues. There may be something that we over-reported, some falls, so we are looking at our protocols for that. And then I wanted to get to the state visit. So we did have the Department of Health come in to Graysdale on 2 complaints in April, and one they found unsubstantiated and one was substantiated. So as soon as I found that out, I mandated that every CNA has to have repeat demonstration training. So everybody who works there has to complete exercises to look at what they need to do and then to repeat it back to an instructor. So we're going to make sure that everybody knows what they exactly have to do.
So it was at that level? That's why you chose the CNA?
Yes.
It was an issue at
Yes.
the CNA level?
Mm-hmm.
I have a question, and because I guess I forget if we talk about it here, if we talked about it at Graysdale, because I know we talked about the reporting of wounds and changing that and looking into that a little differently so we could be more accurate, and also on the fall. So is that what we discussed here, or did we discuss that
We
at the Graysdale
discussed
meeting?
it at Graysdale Advisory.
Do you want to speak to that a little bit? Because I know we talked about how you're going to refine some of that
And
information.
we are working on different ways to get more information out. Wounds are pretty much self-explanatory except for the breakdown of it, maybe with the stages. But we were very good for this month with the total number of wounds.
Right.
And then for the falls, again, I didn't want to, until we really dive deep and figure out exactly what's going on and what we're actually going to report, then we'll break it down into a very specific reporting of what we consider falls. So we are working on delving deeper into that.
Okay.
So that is coming.
Did anyone on the committee have a question?
Sure.
I just got to ask you, maybe the executive can answer it. I don't know what you can say or not say. We received a letter from a person, and you're aware of it, that their father or their guardian of, you're aware of the letter we received,
Yes.
Alleging
I shouldn't say much more than that.
Right.
serious things. All right, so nothing was, I just want to make sure we're dealing with it.
I can tell you that the Department of Health was in on Friday,
Yeah.
and it's unsubstantiated.
Oh, well, that's what you had just, okay.
But this is this just happened in May,
All right.
so.
But you're aware of what I'm talking about, because I
Correct.
got like 3 letters. All right. So I have a question, though, with your report. The cost per resident day, monthly average went down from 308 in March to 267 in April.
Mm-hmm.
What was the cause for that?
It's census. Right, it's,
I was just looking.
mm-hmm.
All right. I mean, I don't want to dwell on it, but if it's a quick answer, because I know we're running late on time. That just caught my eye.
Okay, and just, you're talking about the monthly average.
Cost per resident day, monthly average, March, April.
Right. Yeah, and March is an anomaly. I mean, I would have to dig into a little bit more, but it's kind of just the way that the expenses present themselves. So, for instance, we make bulk payments for nursing home assessment fees all in one month, and I believe they occurred in March. So that right there is approximately, I believe, $800,000 to $900,000 additional in one month that you don't see in other months. But then you see it levels back out to approximately the monthly average. Sorry, around 270. So you get that jump in the expenses in that 1 month.
All right.
And around the November-December timeframe, we have something similar.
Okay. Thank you. That's it for me.
I mean, I know we're still only at 2 stars. What's the prognosis for this? Are we going to be better? Are we going to get better?
Every day
are
we're
we
working.
going up?
We are working towards it.
When do they reevaluate us again so we can get more stars?
So the star rating comes out every month. They look at our quality measures monthly from a time frame.
Okay.
They all vary depending which one they're looking at.
And you're doing okay recruiting RNs and CNAs?
RNs are still tough. Like anywhere, we're having some problems with people saying they'll take the job, they come in,
Right,
and then they don't
okay.
come back.
Now, I have a question. Are all RNs union?
Yes. Well, our floor RNs are union.
And then there's administration or
which
something?
is career service.
Career service.
Right. So that would be your RNACs, your
Are they
infectious
getting
control.
this hourly bonus like the floor people do? And are there salaries? I know Ron and I cut our teeth on the Barston study in 1991, which we will never forget. It's left an indelible mark in our brain about the inequity of salaries. And I'm wondering if all RNs are being paid equally, even though they're not union.
They do not. They
Then
don't.
why? How can you retain them?
Well, the bonus that the steelworkers got did not carry forth to career services.
It didn't.
It did not. They get a different wage adjustment for being in there, so they do get something, but it is not the steelworkers.
Now, tell me that some of these new hires are not making more money than people who have been there.
It's what the union negotiated. Coming in for new RN is not going to be making what somebody is there now.
Well, I said recruiting is important, but boy, retention
Is absolutely. We have the retention committee.
We've
We are
been here
working on it.
forever.
It is
It is an everyday.
And if you're not making people feel happy that they're not worth as much as somebody who was just hired, why should they be happy? So I think that's something we really have to look at
Absolutely.
and find some of that money from somewhere. And
Kind of going back to the census here, there seems to be a growth in the in-home care services that are out there.
Yes.
Does that have an impact? Or?
It does. You know, from the hospitals, in talks with Lehigh Valley and St. Luke's, their first goal is everybody wants to go home.
Sure. Yeah.
And that's paramount. So what we like to do is make sure that those people know if you go home, you have 30 days to come into a skilled level of care, and Medicare will cover you. So we make sure that everybody knows that we go and see, that we visit, knows that try it. We want you to succeed at home, but if you can't and you need some short-term rehab, call us. We'll get you right in. So it is a challenge. We do work with hospitals that have preferred providers. So we are constantly saying, okay, I understand that you're going to send for short-term rehab to another facility. Keep us in mind for the long term. We do provide short-term rehab services. But it is what it is, and we are out there and aggressively campaigning for Graysdale.
Any other questions?
I did want to let you know that Haven House is coming next month.
Okay.
We just have to know the date and the time. And
Yeah, I just heard very nice things about that the other day, if you want to speak very briefly to that.
just that right now they have 69 residents, so they are actively recruiting more people to come in, hiring more people so that they can take on even more residents. They're still doing about 3 a week, so it's very well. They're training staff. We have one of the doctors comes in and does some in-services, talks about different things, dementia, aggression, mental health. So that's been a positive push for us. We are having the town hall still. The next town hall is on June 10th for the staff. So we've been open and transparent with the staff and letting them know different things.
How are they attended, though?
Very well, very well. And it gives them a chance to talk peer to peer.
So what's the number? What'd you say? Ballpark.
I would say 100.
Really?
Yeah,
That's
between,
kinda
I do 3 a day. So I start at 7, I have a 2:30, and I have a 3.
So between all those meetings,
Yep.
100 people. Wow, great job.
Go ahead.
A couple quick questions. Do you know what the state increase for Medicaid reimbursement increase is going to be, what the proposal is?
We got the 1%, you know.
The Medicaid reimbursement rate increase, we received 1% for 2019, but then our rates are completely involved in the CHC contract negotiations for 2020.
Okay. Then the other, speaking of contracts, I noticed that the Nazareth ambulance contract is to probably come before the Finance Committee, and since you guys are here, I thought I would bring it up. Is that covered by MATP? And if so, why? If not, why not?
It's not. We can have a separate contract, or we can go the route of working with the CHC and the organizations that are on there. It's one or the other.
Okay. Yeah, I was just wondering, because it just, I mean, we went through a big deal with the Nazareth ambulance situation a few years back, and I'm wondering why it's not covered under the MATP program at the state
That was one of my first
reimbursement.
questions, yes. And with CHC coming January 1st, which I'll plan on speaking in greater detail at another human service meeting, it's very convoluted. There's a lot of issues with transportation out in the Southwest, so they're saying you can use this system, or you can use your own with the contracted. So contracting works better from all the headaches we hear out west.
Okay.
Okay. Do I have to announce now when the next meeting is? I don't know. Well, because the next meeting would be July 4th, and we're not here.
Why is it not the 3rd when the council meeting is?
We have to discuss. Did you want to do, is everybody available to do it on 3rd?
It is?
We could announce it later. We can figure that out. All right, so then you're all prepared.
You need 2 weeks.
council meeting is July the
2 weeks?
Yeah.
I mean, we're going to meet on July the.
Apparently. I didn't, that's his bailiwick. Mine is to decide when we're going to have human services, so I'll let you know. Thank you. Meeting adjourned, so we can take a break before Bill's meeting. Thank you.
Oh, yeah.
I could move it to the 4th, he
That's
says.
funny. I can't even take it.
What an answer.
You guys are like, Bob's